just to show that people can get articles published on the wildest of research. There's a study out of the University of Michigan. Hello everybody, Nurse Scott here. Today we're continuing my Asked and Answered series to explore a common yet often misunderstood condition, kidney stones. I will guide you through the causes, symptoms, and various strategies for managing them. Stick around for 3 intriguing facts about kidney stones, including one you will not believe. If we haven't met, I'm Scott, a registered nurse with over 2 decades of experience in the emergency department. Currently, I'm pursuing a master's degree to become a family nurse practitioner. Welcome to my channel, but hold off on hitting that subscribe button for now. Watch till the end and see if this video teaches you something. Then, if it did, click on subscribe. Now, let's demystify kidney stones. First, let's understand the basics. Your kidneys are 2 remarkable bean-shaped organs that filter the blood and eliminate waste, toxins, and excess fluid from the body in the form of urine. Sometimes, for reasons we still don't fully understand, substances like calcium, oxalate, and phosphorus, normally found in urine, can crystallize and form small, hard deposits called kidney stones. The medical term is renal calculi. When these stones travel down the narrow tubes connecting your kidneys to your bladder, called ureters, they scrape the walls on the way down and can cause incredible pain. This also causes microscopic bleeding, which we can detect in a urinalysis. Dehydration and certain foods in your diet can contribute to kidney stone development. Additionally, genetics plays a big part, and unfortunately, there's nothing anyone can do to change that. Trying to stay hydrated at all times and not overdoing it on certain foods can theoretically reduce the risk of kidney stones. Try not to go overboard on animal protein, caffeine, dairy, sugary foods and beverages, and oxalate-rich foods like beets, chocolate, nuts, tea, and certain green leafy vegetables. In some cases, medication may be prescribed to prevent stone formation. Statistic tells us that if you've had one stone, you have around a 50% chance of having another. And if you have a second stone, you're about 80% likely to experience a third, if not more. When someone shows up in the emergency department with a kidney stone, our focus is on identifying the issue and alleviating the pain. We often use a CT scan to visualize stones in the body. The goals of treatment are pain control and doing whatever we can to help the stone pass, which isn't much, honestly. IV fluids and some medications such as Tamsulosin or Flomax can be tried to help stones pass. Kidney stone pain is known to be some of the worst pain humans can experience. The old saying is that some women who have given birth and have had a kidney stone say they would rather have another baby than have another stone. Knowing this, when it comes to pain medications, we pull out the big guns, like morphine or hydromorphone, Dilaudid, both potent narcotics used for pain relief. Larger stones can't pass on their own. Procedures like ureteroscopy, where a thin tube is inserted to remove or break up the stone, or lithotripsy, a non-invasive medical procedure, can be used to treat kidney stones. During lithotripsy, an external device delivers shock waves to the targeted kidney stone to painlessly break it into smaller fragments, making it easier for them to pass. Now for those 3 intriguing facts about kidney stones I promised you. Number 1, kidney stones come in various shapes ranging from smooth and round to jagged and spiky, which explains why they can be so terribly painful traveling down the ureter. Second, I mentioned that larger stones can't pass through without intervention, and some are really big. Kidney stones can vary in size from as small as a grain of sand to as large as a golf ball. Irregularly shaped stones called staghorn stones can form in the kidneys themselves and get stuck there until they're treated. And finally, just to show that people can get articles published on the wildest of research, there's a study out of the University of Michigan presented at the 2016 American Urological Association's annual meeting that found that the motion and vibrations experienced during roller coaster rides could potentially help small kidney stones make their way through the urinary tract. I'm serious. Here it is. The study was small in scale, so we won't be prescribing trips to Six Flags anytime soon. And I suppose you could say, well, your response to roller coaster rides may vary. What will they think up next, right? So that's probably more than you ever wanted to know about kidney stones. Did you learn anything? Click subscribe if you did. You know, other kidney problems can be painful too. Check out my next video to learn about an all too common problem, urinary tract infections or UTIs. What's more painful, kidney stones or childbirth? The debate rages on. Let me know what you think in the comments below. Thanks for spending this time with me, and I'll see you next time.